Hey everybody, it's Dr. Dave here. Thanks for checking out my second video. Today I'm going to go over what is cognitive behavioral therapy or CBT. So CBT is a type of treatment that mental health professionals use to treat patients or clients who have various psychological disorders. It's a type of lens that we use to conceptualize or think about how the person may have developed the disorder and then how to treat it. So CBT includes our cognitions, which are our thoughts, our feelings or emotions, and then our behaviors. So I'm going to put up a picture that I showed all my clients who I was doing CBT with. So this figure is called the cognitive triangle, and as you can see, it includes thoughts, feelings, and behaviors, and that the three are interconnected to one another and that they impact each other. So for example, if we wanted to look at a person who may have depression, we would ask them, what are some of their thoughts? And they may say that I think that I am a loser and that I'm worthless. And then we'll ask, well, when you have those thoughts, how do you feel? And they probably will say something like, I feel really sad or down or depressed when I have those thoughts that I'm worthless and that I'm a loser. And we'll say, okay. And when you have those feelings, what tends to happen? What do you do? And they may say that that's when I tend to isolate myself, or I may stay in bed all day and cry throughout most of the day. And then we'll ask, and then what type of thoughts do you have about that? And they may say that, no, I think that I'll never get better and that this will be my future for the rest of my life. And then how do you feel after that? And they may say that makes you feel even worse, right? So we can see how our thoughts and our feelings and our behaviors are all interconnected to one another. So that was an example with depression. And once again, with CBT, we can look at many different disorders through this lens. So for example, let's look at anxiety. So a person who may have a lot of anxiety about meeting new people in public, we can ask, what are some of your thoughts about when you're about to go meet somebody or try to meet somebody in person at, let's say, like a bar or a club? They may say that I think that they're going to laugh at me and think that I'm really, really weird. Okay, and then when you have those thoughts, how do you feel? And they may say, like, I feel really, really anxious and really nervous. And then we'll ask, okay, then what do you do when you feel really anxious and nervous? And they may say that, oh, well, I'll convince myself that I don't need to go talk to them, so I'll just avoid it. And then we know that when a person does this, it makes their anxiety go down really quickly. But in the long term, it actually makes things a lot harder for them to get better over time. Right? So that's an example of how we can use CBT to look at anxiety as well. And I also want to point out that it does not necessarily have to go from thoughts, feelings to behaviors, but that can go from thoughts, behaviors to feelings and any of the other directions. All right, so at this point, once we have identified the person's negative thoughts or distorted thoughts, which are thoughts that are not based in reality, we will think of different ways to challenge those distorted thoughts or to have the patient or client think about them in more rational ways. So for example, going back to the anxiety one example, with the person who was anxious about meeting somebody in person, we may say that they are mind reading, right? So are you able to read the mind of others? No, you cannot. Or another common one is futuristic thinking. So do you have a crystal ball? Like, how do you know for sure what's going to happen in the future? Chances are you don't. So what are some other ways that we can think about this situation that are more rational or helpful? So we'll go back to the figure to talk about how to look at this in a more rational way. All right, so sticking with our anxiety example and the person who is afraid to meet somebody at a bar or at a party. So we can think of what are some more rational ways to think about this situation, right? Instead of that when I try to talk to somebody, they're going to laugh at me and think that I'm really, really weird. So we may say that after challenging the thoughts, that a more rational thought may be, I have no idea about what's going to happen in the future. I cannot see into the future. I don't have a crystal ball. And that I have been able to talk to people before in a social setting, and it went really well in those situations. Hey, then after you have that thought, how do you feel about the situation now? And ideally, they would say that, well, I feel a lot less anxious about it and less nervous. And then after that, their behavior is that they would not avoid, that they would go talk to a random person, whoever they wanted to talk to, and see that they are able to get through the situation, and that over time their anxiety is going to decrease on its own. But if a person continues to avoid it, they're not going to be able to see that their anxiety will go down by itself. To help get over this avoidance, we'll also incorporate behavior activities or exposures for the patient to do. And that will include things such as going to talk to a random person, maybe with a friend, and then eventually by themselves. So with this, you have them do things that they think will be easiest to hardest, so they can, one, develop the skills to go out and do what they're trying to avoid, but then also they can see over time that their anxiety will go down. And typically, by the time they get to what they thought would be the hardest thing that they would do, their anxiety is already significantly decreased. So that was just a quick, easy example of how to apply CBT to a person who has anxiety. Once again, we can apply CBT to various disorders, and a lot of times they are a bit more complex than the example that I gave. However, I did just want to give a quick, easy example that would be easy to follow. Also, sometimes we may just look at the cognitive parts of the treatment. So maybe the person only has the distorted thoughts, and we would treat that through cognitive therapy. Or maybe the person only avoids or only has some of the anhedonia, which is not engaging in activities that the person used to like to enjoy, which is common with depression. There are treatments that just look at the behavioral aspects of things. So that's CBT. Once again, I will include research below. One of them includes the Association for Behavioral and Cognitive Therapies. So in this list, they're all practitioners who do CBT. And then also in the Psychology Today website, you can look and see if a practitioner practices CBT. Or you can ask your own practitioner, who you may see now, if they practice CBT. There's a lot of research showing that CBT is one of the best treatments that we have for treating various psychological disorders. Thanks again for watching. Bye.